going through all the presentations today, I feel that I'm in a wrong place from a healthcare point of view. But I hope that like whatever I present can be useful in that. So there are two aspects of this presentation very different from what we have heard so far. One is that like I'm going to talk about healthcare and how we have been trying to solve the problem in healthcare. And second is adult education. So mostly I'm focused more on the adult education and healthcare. So just to start off with, Asrika Foundation is actually, we are focused on healthcare. We are mainly focused on maternal health. Our mission is mainly to how do you transform birthing experience on the ground. And we have multiple objectives in which we work. The one I'm going to talk about today is predominantly related to the how do we help in the capacity building in the healthcare. See, one of the big challenges in India is, especially in the capacity building in healthcare, is that like especially if we go across north in the states of UP, Bihar, and everywhere, there's a humongous shortage in terms of the skills, in terms of the basic skills and all of that stuff. And there's a lot of programs done by the government of India and NGOs to build in the healthcare, to do capacity building. But what we are trying to do is that like help them to do those things much more effectively by using technology, and at a much more cost-effective manner, a much more impactful manner. So I'll just talk more about like what have we done from the whole thing. So what we have done about 4 years back, we launched our Spear digital platform. Spear is nothing but the societal platform for healthcare. We launched it. It is built on Sunbird, on the Sunbird, and then like it's been completely right now. It's been live for almost 3-4 years. We have close to about 1.4 lakh users on the platform, and it's been used predominantly by the frontline workers. So the target audience for us has been the frontline workers, basically Ashas and the ANMs on the ground, and even the Anganwadi workers. So we have developed the platform to be very, very simple, to be focused more on the rural. As like Nikhil was earlier mentioning, I think the one good thing that has happened post-pandemic is that like everyone is exposed to digital and everyone has a mobile. It doesn't matter whoever it is has a mobile, they know how to use a WhatsApp and YouTube and all of that stuff. So we use that opportunity to see how we can bring the training through mobile to the ASHA workers and ANMs on the ground. And we have done a lot of effort towards making it very simple, easy to access, like an access through OTP, making all the videos short and interactive and all of that stuff. So our focus has been on the easy to use. And we also made sure the content, especially in healthcare, the content is very critical. It has to be reliable content. So all the content is approved by the Indian Nursing Council or by the state health departments and things like that. And also it's open access now. So what I want to talk about is not this. What I thought will be useful for all of you is that like what we have done in addition to the Sunbird ecosystem of the e-learning platform. So what we did is that like in a healthcare specifically, the most important thing is how do we build using competency framework. So about a decade ago, both the Indian Medical Association and the Nursing Association has moved to a competency-based model of learning and all of that stuff. So we thought, how do we pivot our training also to be more on competency-based? Recently also, I think Mission Karma Yogi, where the government of India has launched using the competency as a model of training, and how do you build skills and how do you improve the capacity of all the healthcare, all the workers. The program started for the leadership, but we took that same model and said we'll do it from the ground below and actually use it for building the competencies across the healthcare workers, especially on the ground. So this is just a definition of the competency. We have different type of competency from domain, functional to behavioral and all the other things. But more importantly, I just thought, let me use an example to say how we are using this competency framework and how we are doing it. So if you look into it, I'll take an example. For example, in Bihar, to the ANMs, which are about 30 to 40,000 ANMs are there across the Bihar, there's initiative to improve the digital literacy. So how do I improve the digital literacy for everyone? So Piramal Foundation along with the government of Bihar have come up with defined a 4 set of competencies that an individual needs to showcase that they are digitally literate. Like for example, user devices or like collecting data properly, the quality of data and things like that. So I identified 4 competencies that they want to roll it out. Now how we are helping them to roll it out at scale and effectively is that like we have asked our platform helps them define the competencies on our platform, manage it and define content for it, define assessment tools to know how much the person is aware of it. So we have a step process in which you define the competencies, define assessment tools to identify the gaps, and then also to content to be created like an e-learning platform to distribute it. So when we roll this out across the state, the way we do it is the first step is to identify the gaps. So instead of an approach in capacity building typically of going and training everyone on everything, we decided that like in a digital world, we shouldn't do that. So the first is that like we identify individual gaps. So first step of an individual takes is do a self-assessment, understands where his gaps are, and then have a recommendation engine which only gives you the content that's required to train on that part of it. And also because it's a skills and knowledge part of it, not every gap can be done only through a assessment questionnaire. So we also using the ShikshaLokam's observation module, it can also have a way in which the mentors can actually, for every individual, identify the gaps and using a checklist items, and because if they're not familiar with the competency, they have a checklist, they'll go through a questionnaire, identify that, and based on that, like an individual gaps are identified in terms of what the individual gaps are in each of the skills. And with that, we then come up with training plans and journeys for everyone to do it. And again, being an Sunbird ecosystem, we have all the analytics for people to track the program in terms of what has been the number of people who have done that, by district, by location, how the progress has been on the competency building, what is the current levels, and all of that stuff. So this is how we have built the entire competency framework. We support the entire journey from defining the competency to executing it, learning, and also from program managing it in terms of the progress and all of that stuff. So towards it, what we've done is that we have extended the Sunbird architecture by creating 3 more building blocks to support this. So this is something that we have open sourced it and given it as an from our what our contribution to that is. And these modules can be used by anyone to extend the Sunbird to build them to system to do it. Now I'll just walk through the 3 building blocks. And again, I'll use another example where we're using it. So another case study where we're working again in Bihar is that there are about 330 called the A&M nursing colleges. A&Ms are nothing but the diploma nurses, a 2-year diploma course for nursing. They come out of the 10th and 12th. They pass after 10th, 12th, they go through these 2-year diploma course to do the nursing. There are 330 colleges that do nursing, but the quality is not that great. And therefore, they're unable to find good jobs. And not high-paying jobs. Their job, the market is very tough for them. They're not able to get the right thing. At the same time, they also want ambition with the nursing. Now everyone wants to go abroad for studies and all of that, so for work and all those things. So given that, the government of Bihar decided how do we create a certification process that's outside the colleges, so that an individual can go get them certified and prove themselves that that they have the skills, which in turn can then be used them to get better job market, and that recognized by the hospitals and everyone, so that the recruitment can better and the starting salaries can be better, because currently the hospitals don't pay a lot because they think that they have to train everything as soon as the person joins. So to address these gaps, the first model we created is the framework called the fracking, which is a process in which you create the competency. That's a model we created in which for any position, you can break it down, identify the competencies required for an individual to perform a role. Just on the domain side. For example, for an A&M, using this framework, there are 40 competencies an individual needs to perform their job. Things like pregnancy identification, how do I do various things. So there are all basic competencies, but this is based on the nursing call syllabus and all of that. So this is one model in which you can do anything. Like for example, we can define digital skills, any new skill development, everything can be done. So this is one model we created where how do you identify the skills, and that's very critical because everything in the journey is mapped through the competence. Like for example, content you create, assessments you create, engines you create, everything is mapped to the competency. So the journey is done, tracked through that, and hence the competency becomes a critical module in which through which the entire the competency, the capacity building is done. The second one is the a passbook. So this is basically a concept in which you maintain the individual history. Like for example, if someone has done trainings, you can go back and see what are the competencies they have built, what is the passbook in terms of what are the skills they have built over a period of time. So it becomes like an individual resume. The idea is that over a period of time, these could become on your resume, where you can actually, we get a resume builder on the platform where someone can click and create a resume out of this passbook. And now again, the passbook also, what we have done is that to make it a proper, effective way, there are different type of entries in the passbook. Like for example, one is that I do my own self-assessment. I can go through a randomized questionnaire and assess it. It'll give me that yes, you have the competency. That's one way of doing it. Second, I can do a course on the platform, which then when the course does complete the course and do the clear it, then I can get again I can recognize that I have the competency. Then there's a third is observation, where the mentor can observe an individual and then identify, either in the classroom, in the labs, or it could be in the service, it could be at the work environment. So that's another type of evaluation of the person's skill. The fourth is 360 degree. For example, you can have a peer network where peers can go through a survey like we are used to 360 performance appraisal sort of a thing. We can have a process in which a set of questionnaires, again, we can use observation module to do that, and then get them, and based on that, identify the skills an individual has. And the last is like an ability to upload data. If someone does the courses offline, you can also upload. So the passbook becomes a history of the every individual's the history record. At the same time, from an organization point of view, like for example, from a state government point of view, they can get a quick check about like how is the competency spread in the state, like where is the competencies lacking. So they can run special initiatives to drive the competency improvement in a certain areas and all of that stuff. So passbook becomes critical. Our intent is that like over a period of time, the passbook becomes a way in which once you credentialize it and make sure the process, the right type of the tools are used, then that becomes a resume builder and a more trust on terms of a resume in terms of what you're saying, and it is not like your what you make it up, but what's really true. One of the, I think Nandan, one of the speeches has said that like this could potentially become your digital tool where, I mean, just like you have certificates, everything on your digital part of it, this also becomes a tool where in which you have your all credentials with you, which is trusted and encrypted so that anyone can validate it and easy to get a job. So this is the second component we have created. And the third one is the learning path. So one of the challenges that we had when we rolled this out in Bihar in the A&M colleges, that like, even though people are aware of the mobiles and they know how to use a WhatsApp and all of them, they are not good at exploring. You tell them, okay, this is a relearning tool, now go do what you want, they just stumble. You really need to handhold them in the process. And we realized that like how much ever we tried, because we can't scale it to go to every location and do it, we decided, okay, why don't we then change the entire user interface where it doesn't, there are two ways in which you can run your programs on it. One, you can let it explore. You can go explore and do what you want. The other is that like it's goal setting. So for a department can set that these are the competencies and this particular cadre has to do. And then the platform will drive every step of the way. You just log in, it tells you need to do this. You click, it'll do assessment. If you fail, you click, it tells you, no, now you do a course. And it continuously pushes you in the right direction. Without you having to navigate across the whole platform. The idea is that like this is to make sure the technology can be used even by the at the rural healthcare workers without having to worry the complexity of the technology, all of that stuff. So we have done a lot of effort to do that. Again, that entire module has been modularized in a way so that anyone else who needs a customized journey, where journey paths are customized to every individual and set by the organization, we can reuse the whole thing. So these are some of the things that we have built, I just thought of sharing this because one of the things we have realized is that like slowly at least in the learning part of it, people are moving away from a generic learning to a competency-based model, and it is slowly becoming the way in which you teach, especially at the some of the skills level where you're looking at jobs and all of that stuff. This competency becomes a key, and we are right now the only platform, at least we have a full-fledged solution for competency where we have the entire journey for the competency mapped, and we can do that one. So that's all I had. This is just like where we are impacting. So thank you.